As a provider, it matters how you talk to a patient about a treatment you recommend for that patient. Remember, as patients, we don't always understand why you think we need a particular treatment, and we never understand your jargon. My guest today works with dentists to help them talk with their patients better, but really her advice spans any type of specialty. I'm Carl White, principal at Market Advisory Group, which is a healthcare marketing agency, and I'm also the host of Practice Care. The mission for both is the same, and that's to help private practice owners stay private. Not only is that usually what they want, but care is better when the provider owns the practice, because that's when they're going to have the most freedom to make the clinical decisions they think are best. It's just not quite the same when somebody else owns the practice. Usually, eventually, their agenda starts to creep in. Some compromises have to be made. Certainly more has to be thought about, whether nothing else happens or not. Let's just keep it private and kick all that out. My guest today is Sharyn Weiss. Sharyn is the CEO of Weiss Practice Enhancement, a Californian practice management firm serving dentists nationwide. She's worked with hundreds of dentists during the last 20 plus years with a focus on patient and team motivation. And her mission is to help dentists become confident leaders of a profitable practice. Sharyn, this has been on the books for a while. I'm glad we get to do it. Finally, thank you for coming on Practice Care.
You're welcome. It's my pleasure.
Yeah, I think we've had more emails about other stuff than this episode between then. It was September, actually. Now we're in December when we're recording this. So 3 or 4 months ago, this whole saga started. So it's great to finally get this one recorded. I want to start with you where I start with every guest. The bio I asked you to send me, which I just read, it's short by necessity, but help us get to know you better. I always like to know the career trajectory on that side of life and how you ended up doing what you're doing, why healthcare, all those sorts of things. But go wherever you like. Just help us get to know you a bit better.
Well, since this is such a niche field, I didn't actually grow up hoping someday, I hope to God, I'll be a dental consultant. That never occurred to me. But it ended up in this miraculous way of incorporating so many of my interests, skills, and passions. I've always been interested in this field of organizational development, training, consulting. I very much like both how a culture develops in an organization and how systems can enhance or blow that culture up. So I first started off working as a trainer and with youth, and then graduated eventually to working with adults, and then expanded into working in consulting. Landed a job with a practice management firm called Pride Institute, which was a dental practice management firm, very well known. And then I branched out on my own and founded my own company about 5 years ago, Weiss Practice Enhancement.
And stayed with dental throughout.
Yes. So I've stayed with dental because I get to do it all, right? We're looking at what is the internal culture of the practice. So I get to work with the frontline employees. I get to work with the CEO, and we get to directly affect patient care. As part of my work, then I work one-on-one with the dentist in this case, and then I do training with the team virtually or in person. So it all ended up incorporating everything I was originally interested in.
Perfect. And so let's get into it. When you and I were talking about this episode, we called it, we had 2 different titles. One was modernizing the treatment presentation, and the other one was turning it from treatment monologue into treatment dialogue. And I think they mean similar things. But when you say these 2 concepts, let's start here. What do you mean by that? Just so me and you and listeners, we're all hearing it the same way and thinking about it that way.
So what I've observed, sadly, is that most health practitioners, if they're taught on how to work with patients, they're sadly taught from the same model, which is mostly me as the healthcare expert will tell you, poor patient, what I've seen. Here's your diagnosis. I'll talk real fast while I tell you that.
Yeah.
Then I'll spend some time scaring the bejeebers out of you, telling you what's going to happen if you don't do this treatment. So it is no wonder that patients walk away saying, at least in this case, I hate coming to the dentist, or walk away from a doctor, another kind of physician, and are confused and disengaged in the whole treatment process.
Yeah. It's funny when you say scared of dentists. I've always associated that with, while in the chair. I never thought about, and even in the anticipation of,
Wow.
but I never thought of, I'm walking away scared because I just got, a doomsday scenario told
Uh-huh.
to me, and I'm
Uh-huh.
some idiot, I guess, if I don't do what I was just
Exactly.
told. Yeah.
Exactly.
Yeah.
Well, let's look at just this little fact, right? That most healthcare practitioners, especially dentists, have to remind patients over and over and over to come to their appointment.
It's
And
true.
even with
I
text,
rely on those texts. I'm not gonna, I won't lie. I'm like, thank God for those texts because I don't have to think about it,
but here's the contrast, right? So basically, they're begging patients to remember their own appointment, right? And let's contrast that to, at least for women, will relate to this. Women do not have to be reminded of their haircut appointments. We do, right? We will get there. We will reschedule things so we can keep that appointment. And we have to look at why is this, right? Well, and really, it's because patients don't want to go to
Yeah.
their professional because it's such an unpleasant experience where, and here's the most important line, they see no real benefit to themselves.
To the patient.
But yeah, the patient doesn't perceive a benefit. And so at
That's
least
stunning. You got to expand on that.
let's look at that, right? So first of
So they
all,
don't see any benefit in having, cleaner teeth versus
yeah,
dirty. I don't know what. Yeah.
they might see, hey, I should go to my quote unquote cleaning. Sure. But even because so many dentists call it a cleaning, as well as patients regarding it like a cleaning, that doesn't sound too important to me, right? I can get my car cleaned or not, but it's still going to run. Who the heck cares? I can get my carpets cleaned or not. And so the other part of that is people think, well, I clean my teeth at home. Why do I need to go there for them to do it? It seems like this is all right, I could, but who gets too excited about it? And part of the problem is that because healthcare professionals don't make any connection between what a patient needs and what a patient genuinely wants in their life. So I will go to my haircut appointment.
Yeah.
Because I want to look good. I want to feel better about myself. That's my motivation. When you look in at least dental care, very few practitioners will ask a patient, what is it that you want for your smile? What do you desire for your overall health? How can I support you in getting you with what you dream of? These questions are not asked.
Yeah. So it was like a lead in. I mean, the question is, why do providers seem to struggle so much with this? So, the lack of connection. It's a very clinical it's a very clinical environment in which they were taught. They're taught by clinicians to do the clinical things. I've thought for a long, I'm no longer surprised. I'm still a little shocked that in pick your specialty, dental school, medical school, whatever school, not only is the word business kind of dirty, but there's no training or anything. I mean, at all. And this communicating with patients would be a part of that curriculum. So why? I mean, why do they struggle so much with this?
Healthcare practitioners are generally taught facts and to rely on facts and logic to communicate with patients. That would be okay if patients themselves responded to facts and logic and thought that way themselves. Patients do not.
And humans don't.
Yeah.
Of which patients are a subspecies. Yes. Yeah. Same with doctors.
Maybe some engineers or mathematicians, you give them a treatment plan. They want to know, more questions about the materials going to be used. But for the general public,
Mm-hmm.
most of us make our decisions based on emotion,
Mm-hmm.
and then we kind of back it up with logic. But it's
Yes.
the emotion first.
Mm-hmm.
So most healthcare professionals are not speaking in the language that the patients are speaking, and they do not understand that. And so they continue to bombard a patient with pictures, x-rays, models, pamphlets. All of these are facts.
Mm-hmm.
And then they're shocked when the patient says, I don't know, I'll think about it. Right? Well,
Yeah.
they don't know how to respond to that. I'll think about it. The I'll think about it is saying, I don't see what the benefit is yet for me. I feel afraid of what you're telling me.
I'm not sure I understood what you just told me.
Yeah, I don't.
Yeah.
So the easiest way for me to regain control of this situation is to say no,
Mm-hmm.
or I'll say, will insurance cover this?
Mm-hmm.
Or I'll wait till insurance covers this, or I'll have to talk to my spouse about it. All of these are smokescreen typical responses, but they all cover up the fact that the patient isn't sold emotionally
Mm-hmm.
on the treatment.
Which is not an easy thing to do. I mean, that's a whole skill set,
It is.
and so we know it's not trained. One of the things that's sort of in the back of my mind when I think of, and this is going to be a gross generalization, really specific to not so specific to dentistry, but you could say primary care also, you know, it takes time to peel the emotional onion of a patient. What do what's going on in there? Um, the, there's a lot of dental models, practices that are built more on efficiency and throughput. The word production, not a word I'm a big fan of because it sounds like a factory rather than people, but nevertheless, it's a very commonly used word. So production, speed, efficiency, throughput. How do you have that kind of peel the onion conversation if your throughput's going to suffer?
Yeah, actually, it's much easier than you think, right?
Okay.
First of all, what I've developed over the years is a series of questions that you're going to ask patients.
Mm.
So, way that should make the practitioner's life easier because all you're doing is asking questions. That's it. The patient themselves is now going to uncover their own reasons to do this treatment.
Mm-hmm.
That is wonderful. You're out of the business of pressuring patients, pushing patients, scaring patients. You don't have to do any of that. And if you can do this conversation right, think how much time you save on the back end because you're no longer chasing your patient down and
Mm-hmm.
same damn conversation year after year after year. And so if your final goal is to have a higher case acceptance where the patient says yes at the time of diagnosis,
Mm-hmm.
this model is what you should be doing.
And are the questions that you have, are they kind of dental specific or would they apply to
They would apply to anybody.
anybody?
Here, and it has to be a dialogue, not
Yeah.
dialogue, right?
Yeah.
So if I was to say, look, the first thing you should do is if you're going to give patient any information, do it think of to yourself one-to-one.
Mm-hmm.
I can talk for a minute and then I need to stop and ask a question.
Mm-hmm.
So, for example, let's say you're up to the diagnosis part of
Mm-hmm.
communication. So you could say, here's my observation of
Mm-hmm.
patient, right? Here's what I'm seeing, X, Y, Z. Now stop. Patient, what have you observed? What have you felt over this? How do you feel about what I just said?
Mm-hmm.
This will give you a lot of information right there, right?
Okay.
That's the first part.
Yeah.
Okay. The first part is engaging the patient,
Mm-hmm.
right, in their co-diagnosis. And this is a term that dentists probably are familiar with, but maybe not other healthcare practitioners. The idea of co-diagnosis is the patient is uncovering the need for treatment along with the doctor. Okay, so you've engaged patient, you've shared, all right? Here's what I'm seeing. How do you feel about it? What are your thoughts? What are your observations? Next step would be, here's what I recommend. So, patient, I'm seeing cracked tooth in a case of a dentist, whatever, right? Okay, now here's the beauty part. You're always going to phrase whatever you recommend in light of what the patient wants for herself. So, patient, I'm seeing a fractured tooth over here and some decay. What have you noticed? Okay, patient talks. Well, patient, because you said XYZ was important to you, I'm going to recommend this. And this is going to be great for you because it will address, and whatever next comes out of the practitioner's mouth has to be about that patient's motivator. So, patient, I'm seeing a fractured tooth. Let's say, but I don't care about my fractured tooth because all I care is about having a brighter smile, saving money. So now you adapt to that. Hey, patient, I know you want to save money. I know how important that is to you. And that's exactly why I'm going to recommend this. This is how this will save you money. All right. In about 3 minutes, you already addressed what is the patient's motivator and told them, here's how you're going to get your need met.
It's really, I mean, you've got a goal and treatment to meet the goal. In life, I was having a totally different context, talking to a client yesterday. They're building a marketing plan. What do you think we should do next? I'm like, well, your goal is X. So we could attack this, or that. And each of these, same idea, like, a plan absent a goal. I don't know. Do you coach clients also to say, look, I don't know how you would phrase it, but look, do nothing's an option, right? That's a choice. And, the concept, or however you would phrase that in, do you bring that in? It always sounds like you got to do something. Well, time out, dude. I could walk out right now. So acknowledge it, right?
So there are a few things that are at play here. One is most practitioners recognize that you have to do something called informed consent, right? So the patient has to know, look, I can do nothing. There could be consequences of the treatment, or there could be consequences of no treatment, right? Absolutely. The mistake, though, most people make is that they emphasize this. They focus on this. They focus on the consequences and thereby scare, the bejeebers out of your patient, who's now totally confused about what they should do. So if, you have to do informed consent and the patient has to recognize you could choose to do nothing. And in fact, this is actually a good thing, because when patients feel they have no choice and you're pushing them to do something, they will resist. Right?
And you know what? We've faced this, just my own family, and what we walked away going, honest to God, it was a general dentist, and we thought, feels like it's money first over there, which was probably the furthest thing from the truth, right? But with what we could grasp and what was told to us, like, I don't really, and I couldn't, if you asked me, spell that out why. Like, I'm not exactly sure, but I can't think of another reason, because there wasn't a compelling reason to do it. Or if there was, it was buried in, I don't know what. But,
so you're on some sort of conveyor belt, right? Of next head, let me see what treatment I can find from you, right? If it me, the dental office. Or practitioner's office. So yes. So what that practitioner could have said to you is, Carl, what's more important? What's most important to you right now for your dental health? What do you really want? And then whatever you said, relate the treatment recommendations to that. If you want, now I want to give you some agency, Carl, right? I want you to know you're in charge. So at the end of that conversation would have been some questions. Carl, based on what we've just talked about, what do you see? as your next best step.
Mm-hmm.
Now, if you felt comfortable with that person, you might have said, I don't know that I want to do any of it, right?
Yeah.
And the dentist or the practitioner should have then stopped right there and asked you more. Tell me what you're thinking.
Mm-hmm.
No judgment, no blame, no
Yeah.
pressure. Just tell me what you're thinking. Tell me what, is getting in the way for you.
Yeah. Yeah. I mean, I wonder, it's probably a big change for maybe every client that you have at the beginning when you suggest we're going to change how you talk to patients.
Yeah.
And I wonder, like, you know, if somebody's going to go down this path from what you've seen of your clients who embrace it and do it successfully versus maybe those who don't, what are the characteristics of, for listeners who are thinking, she's making a lot of sense. What should the dentist be ready for in order to make this kind of change?
So anytime we take on a new skill, any new skill, I don't care what, right? You're going to feel awkward at first.
Yeah.
It is inevitable.
Yeah.
And if you don't feel awkward, then I'm wondering if you're really trying. So what I would ask them to do is recognize that you're going to feel awkward. Mm-hmm. Yep. It's exactly like, the first time you were in medical school or dental school and trying a procedure. Mm-hmm. It's feel great. And yet, right, this is the process, the learning stage you go through to learn this new skill. Mm-hmm. As the result at the end of the day is that now you are connecting to your patients, mm-hmm. connecting as human beings. And most dentists I work with, I know it doesn't seem like it, it contradicts the stereotype, but most of them are really caring, vulnerable people themselves.
Sure.
They want to connect to their patients, but in a more quiet, deeper way. Mm-hmm. This allows them to do that because now you're having a real relationship. Mm-hmm. Nothing can beat that.
Yeah, it's very sticky. Right. And it's very sticky once you get good at it. Absolutely. Yeah. Cool. I say this to a lot of guests. We could go deeper and deeper and more, but in the interest of more bite-sized advice here on practice care, there are two wrap-up questions I ask every guest. The first one is just to kind of cover our bases. Is there anything you think I should have asked you about this topic, but I just didn't ask you?
Well, one of the things I can offer is that I have job aids and articles that can help dentists do this. And so if anyone wants that, I can provide that. And I've written extensively about this in articles in dental economics as well.
Okay, great. Okay. And then the other wrap-up question is, so imagine we've caught the attention of, we hope we have, of listeners who say, you know what, she's right. This has been an issue. I see it. Sometimes people get enthusiastic about starting something new, but they're stuck at the starting line, right? They say, where do I start? Where do I go? They get kind of stuck. Are there even one or two simple things that you'd recommend that they could do to nudge them off the starting line, as soon as they're done listening to us here?
Well, I would start with new patients, with every new patient you see today or tomorrow. And instead of diving right into clinical diagnosis or exam, before you do anything, I want you to sit there, look at that patient eye to eye, and start asking them some open-ended questions. Mm-hmm. Not only what brought you here today, but how do you feel about being here today? What's your previous experiences with this, either good or bad? What would you love to have for your oral or overall health? And just ask open-ended questions and see what emerges. Because if you're listening carefully, the patient is going to tell you what's important to them. And that is going to be the key to unlock everything.
So here's a question. So what are your keys to, Carl, what is it you really want from your oral health? And I say, I don't really know. I never thought about it before. Full stop. What's the response to that?
Great. Okay. Then
Yeah.
I might go sideways so I hear you say, you don't know yet what's important to you. Okay. Well, what about your overall health? What's happening with you just in general?
Okay. And maybe try to circle back around and tie oral health to the overall.
Correct, because what most patients do not realize is the jawbone is connected to everything else, right?
Right.
And so, everything they have, let's say a sleep disorder, they have diabetes, they are pregnant or want to be pregnant, they have headaches, all of these things, they have heart disease, all of these things interact with dentistry. And so, even if you call, say, I don't have any real goals for my oral health, like teeth look okay, nothing hurts. Yeah, there's something in your overall health that we can now connect to.
Ah, love it. Okay, cool. All right. I could do that. I could give that a shot. Perfect. Perfect. Sharyn, this has been awesome. It's really very eye-opening. It's funny when you say it out loud, it sounds very, a former boss used to say, try to be simple without being simplistic. And to me, at least, you've nailed it. Simplistic is dumb, but simple is the goal. So it certainly feels approachable. Thank you for coming on Practice Care and sharing these insights with our listeners.
You're welcome. Thank you.
Yeah, and you supplied some contact information. We're going to get all of that into the show notes for your episode. So anybody who wants to reach you, this is another way to do so. A couple of other points before we wrap up the episode. First, if you're someone like Sharyn or I, you serve private practice owners, or if you're a private practice owner yourself and you've got some experience on the business side of healthcare, either way, no matter which seat you sit in, we want you to come on Practice Care and tell the world about what knowledge you have to share. In the show notes for Sharyn's episode and every episode, there's a link, a couple of clicks, questions. Tell us what's on your mind so we can get you scheduled as soon as possible. And finally, we do a new episode every week of Practice Care, and the easiest and best way to stay up to date with them is to subscribe to Practice Care. We're on Apple, we're on Spotify, we're on Google, we're on YouTube, all the platforms, all the players, we are there. Subscribe so that you can stay up to date. Thanks very much, and until next time.